Good morning, Ordinary President. Good morning, Brekete Family.
Yes, sir. Your name na?
My name is Dr. Christopher Otabor'S. I'm a surgeon and the medical director of Alliance Hospital here in Abuja.
And I no go clap for him. Now my personal doctor be this, so now the only person where they feed. Anyway, continue, sir.
Ordinary President, I want to thank you so much for the opportunity to always come here to handle the microphone and talk to the whole world. I know that my audience is beyond this room and my audience is beyond Nigeria.
Yes, sir.
I'm actually talking to the entire world. It's a rare privilege and I don't take it for granted at all. Thank you. I also want to thank God for your life.
Thank you, sir.
Because when people have problems in their homes and they are crying to God for solution, you have become that solution to many around the world. Thank you. Yes. And what I'm also doing here today is part of, the process of saving life. Yes, giving out information, vital information that will lead to necessary action that can save lives. So that's why whenever I'm coming here to talk, I don't just take it for granted that I'm a doctor. I go and do my research so that I know that I'm passing accurate information because people are listening. So I want to say thank you again. Sir. So this morning, I'll be talking about something that has become very common now in our environment. And one way or the other, we are all affected or will be affected. Yes, I'm talking about colorectal cancer or bowel cancer.
Bowel cancer?
Bowel. That's intestinal cancer. Yes. In my practice recently, I noticed that the incidence is increasing so fast. Within a span of 5 months, we are seeing like six cases of cancer of the colon or of the rectum. So, and I thought it is good to talk about it because to a large extent, it can be prevented. And if detected in time, lives can be saved. Unfortunately, most of the patients that come to us with cancer of the bowel, they come late. Yes, and so they don't have too much time to live. So that's why I want to talk about it today. So it's about 52,000 people die from cancer of the bowel every year around the world. 52,000. That means in a day, let's say about over 100 or so. Over 100 people will die. Before the end of today, more than 100 people would have died of cancer of the large intestine. Yes, it's that common. And it is said that the lifetime risk of, at the age of 85 years of age, we have 5% chance of developing the disease. That means if you gather 20 people together now who are 85 years of age, about 5%. Sorry, let me explain it this way. If 20 people are born today, by the time they are 85, one of them would have had cancer of the bowel. So that means it's relatively common. So how do you detect cancer of the large intestine, colon or rectum? Let me talk about the symptoms. So how you will know. First of all, it is commoner in people who are 50 years and above. It's very rare for you to have cancer of the colon at the age below 50, but it's coming up now. So that means our senior citizens should really take notice of this and they should watch out. So even those of us who are young, we should also take the information to our parents or our grandparents. The first and the earliest sign of cancer of the bowel, the large bowel, is change in bowel habit. Yes. So you have period of constipation alternating with diarrhea. Every individual, depending on the type of diet we take and our lifestyle, have come to observe a certain pattern of bowel habits. Some people in the morning, the moment they wake up before breakfast, they must go to toilet.
Na me be that.
Okay. Some, they go to toilet once in 2 days. Yes.
Those kind of people mess,
and that and that one in 2 days is normal for them. It's okay. But as long as that is what your habit is, fine. But if you have now noticed that instead of going to toilet every morning, you find that 2 days you are not even having the urge to go to toilet. 3 days you are not. Instead of every morning, you are now going like twice a week, and then maybe the following week you are now seeing that you are having diarrhea, which means instead of going to toilet once in a day, you are probably needing to go to toilet like 5 times in a day, and it's watery. So that means that there has been a change in bowel habits. Constipation alternating with diarrhea. And then for some, when you go to toilet, it will be as if you have not finished emptying your bowel.
Yeah, it dey do me sometimes.
Yes.
It be like say I don't get that sickness with that.
No. See, that can happen once in a while.
Okay.
When it is not cancer. But if it is repeatedly, you are having those, and again, so that's not just the only symptom. There are a number of symptoms that you need to tie together. And I need to also emphasize this so that people don't run away with only one symptom and think they have it. No. So that feeling of incomplete voiding, as if you've used the toilet, but it's as if something is still there, is also a major one of the signs. Then the change in the shape of your poo-poo.
So person go sit down, they check the shape.
Yes.
Hey.
Some people with cancer of the colon or rectum, their stool would now be like that of goat with pellets.
But
Yes.
it dey do me sometimes.
Yes. That can happen in chronic constipation, and yet it is not cancer of the colon.
Oh, okay.
But if it is cancer of the colon, this can be a major warning sign. So you have the stool can change in shape. It can become like that, small pellets instead of the normal shape that we are used to. Then also, it can become narrow, very thin like pencil. Instead of the normal caliber. Then it can also become like very loose, like diarrhea stool. So there are different shapes. Okay, it's on the screen now. Those are the different shapes that it can take. So that is a warning sign. It means that the caliber of the tube, because the intestine is a tube, and if something is growing inside the wall of the tube, it reduces the caliber of the tube and it changes the shape. So instead of it coming out in one block the way it normally is, it can now take different shapes, to come out. So that is also a warning sign. If you notice that consistently, then you should raise an alarm. Then we can also have blood in the stool. Now, blood in the stool, we need to be careful about blood in the stool. Many adults will have blood in the stool when they have bile or hemorrhoid. But that blood in the stool with bile would be blood either on top of the stool, or the blood can even stain the toilet seat, and it's bright red blood. That is bile, hemorrhoids. That is not risky. It's not something that trouble us too much as doctors. Even though we need to take care of our hemorrhoids if we have it, it's very common. But that you find blood on top of the stool or by the side, or sprinkling on the toilet seat, that is not much of a danger sign when we are thinking of cancer of the colon.
Doctor,
yes.
Kunle Adek say, ordinary president, please kindly help break down the word rectum, colon in the body part for more understanding, sir.
Okay, rectum is the lower part of the intestine, just where stool is stored before it comes out.
The pipe way there for your belly, where then they call intestine. The last place where connect to your anus.
Yes, that's
Na
the
be
rectum.
rectum.
Yes.
Continue.
Okay, thank you so much. Okay, so but the blood in the stool that is more associated with colorectal cancer, especially the one high up, it is mixed with the stool. It's not just on the surface. You will know that it's like there's a mixture of these two with blood, and also mucus, something like catarrh on the stool, and when it's not infection, there are many things that can cause mucus in the stool. But if you are having mucus in the stool persistently, and the stool is sticky, and then there's tenesmus. Tenesmus means when you go to toilet, you want to pass stool, and you are bearing down so much, and there's so much discomfort around the lower abdomen, and you are pushing with so much effort, and there's a lot of discomfort and some pain. That's tenesmus. It can happen in some form of dysentery or bacterial infection, but when it is continuous for some time, then you must see a doctor to check what is going on. Then, of course, there will be pain. There can be pain in the perianal region. There may be no pain at all. Most of the patients that come with this kind of cancer, they just come suddenly. Doctor, I could not pass stool for the past 48 hours and my abdomen is distended. So that's the commonest way in which patients come to see us. And when that happens, that means that it's already a big problem. There may be lump in the abdomen, and of course, most of the time they will have weight loss. You find an elderly man, 56 years old, 70 years old man, who has lost weight recently, and there's no explanation for that weight loss. Yes, and he's looking sickly, he's looking a bit pale, but he's not having fever, he's not nothing. We need to check. There might be cancer somewhere. Okay.
Yakubu Aliyu Fana, he said, good morning, my ordinary president, and good Brekete family. Doctor, I always use toilet with blood and too much back pain. This is coming from Yakubu Aliyu Fana.
Okay, so if he's a young man of, let's say, 30 years, we are probably dealing with hemorrhoids. There are many reasons why that can happen. Yes. So blood in the commonest reason why anybody will have blood in the stool is bile. That's hemorrhoid. Okay. But if hemorrhoid happens, even if it is bile, if it happens in a man of 65 years, you must rule out it is cancer of the bowel until proven otherwise. Yes. Because cancer of the bowel, the first sign you can see is like you have a pile. But when you dig deep, you discover that something is going on higher up. So what are the possible causes of bowel cancer? It's not something that the general population know very well. Like the general population know a lot about appendicitis. They know a lot about hernia. That's why we need to talk about this for people to know. So what are the possible causes of cancer of the bowel? Like most cancers, only very few cancers have a very definite cause. We say, yes, this is what causes this. Like cancer of the liver, we can point to hepatitis B infection that was not treated. We can say this is what causes cancer of the liver, or some other cancers that have known causes. But generally, we talk about risk factors when we're talking about causes of cancer. And in this case of cancer of the bowel or colorectal cancer, we're also going to be talking about the risk factors. The first risk factor here is hereditary. If somebody's father has had a cancer of the large intestine or cancer of the colon or the rectum, there's a higher than normal chance that the children may be predisposed to cancer to colorectal cancer or a first degree relative. But the second most important factor is diet. Yes. People who take a lot of low residue diet, have higher chances of developing cancer of the colon.
It can be example of low residue diet.
Okay, so low residue diet are diet that are very limited in fiber, like refined grain. Let's say, for instance, you want to eat corn, and the engine has blended the corn, has removed the shaft, has removed all the cellulose. What you are having is powder. If you use that powder to, whether you use it to stir it and drink it, or use it to make it eat anything, it's a low residue diet. But if you blend all the cellulose and the bark together and eat it, that's a high residue diet. Because those husks can they constitute bulk, and they help to move the intestine faster. Yes.
So me where they like snacks like Abu now.
No, Abu is snacks for you.
Anything where they wrap for leather, no be snacks be that.
Okay. Okay, so I mean, part of the reason why colorectal cancer was not common in Africa, in Nigeria, is because we were taking a lot of fiber, like root fiber, cassava. When we blend cassava, all the fibers inside, we eat it together, and so our stool is bulky.
So you go.
Yeah, so it helps movement of the intestine.
That is, the movement is propitious.
Yes. All the toxins that are in the intestinal tract is pushed away.
They will follow, come on.
Yes, but when you have low residue diets, even the stool, the size of the stool is small. Example
of that one be say, if you go toilet, this Oyibo toilet where they sit down on top, and your shit dey water. If you press, sure, you know they go. It go still remain. But if you did twe like ordinary oat, as you press, sure, you go here, whoa, podom. You don't go with that.
Yes, so then fruits and vegetables helps to improve the fiber in the diet. So if you have, in fact, anybody from 50 and above, your diet should be at least 50% fruits and vegetables. That's the shortest cut out of cancer of the
problem
bowel.
Is your fruit expensive.
Yeah, vegetables, cabbage, lettuce, cucumber, whatever. You can plant them by the side of your garden and harvesting from them.
I even get one of my daughters where they sell their fruits. After your program, she go and announce.
Okay.
How you go dey cheap for them.
Then too much consumption of red meat is a problem. It's a common. There's a strong connection between eating red meat, especially the processed one, and cancer of the colon. Those who eat a lot of red meat, some people, it's like they were born with suya. If they don't eat suya every night, they won't rest. If it happens continuously like that every day for many years, your risk of developing cancer of the bowel is higher.
Some ladies said, if you no carry them go buy suya, your date never start. Continue, sir. Sorry.
Okay. Then people who are overweight, obesity is a common is a common predisposition to different types of cancer.
Sir, is kilishi a red meat?
Yeah, it depends on what red meat is muscle from cow.
Oh, okay. Yes. Goat no be red meat.
Well, there's red meat in
make una reduce meat generally.
Yes.
Simple. Yes. Whether red, blue, green, white.
Yes.
Meat na meat, you reduce them.
In fact, as we get older, our protein intake should be reduced. That also helps to prolong lifespan. Because too high protein intake reduces lifespan by about 10 years for an average of 90 years old.
When I don't hear now.
Yes. Because it takes the body a lot of work to digest protein and deaminate or to make the content to be less harmful to the body.
Okay. Somebody say, good morning, my ordinary president. Please, can I ask Dr. Otabor'S, our own Dr. Otabor'S, so they don't own them now. Our own Dr. Otabor'S, how I can get to see a cardiologist in his hospital. I called their line the other time. A lady picked up and wasn't even bothered to talk.
Oh, sorry about that, but that's actually the easiest way. You should try again.
But give us the phone number, sir.
Okay.
In case the wrong number she call.
Okay.
And while the Dr. Otabor'S, they look for the number, Matthew Okegwa, he said, good morning, my super ordinary president of the... thank you. Demola Mike, he said, please, can chemotherapy cure cancer?
Yes, chemotherapy is one of the ways in which cancer is treated. Yes, it's just one of the ways. Yes. Well, I will get to chemotherapy during the course of this conversation.
Demola Mike, he said, Dr. Otabor'S, very humble man. God bless you.
Thank
Mary
you, sir.
Isaac, he said, he's even a young man. Okay, I beg give us, for those of you now, we go come ask me about Alliance Hospital number. Take note. After today's program, you can go and play back. Fast forward to almost 9:30. You go see where Dr. Otabor'S announced phone number. No, call me. Thank you. Sir, are you ready?
Yes, sir. 081 73 48 09 09.
Repeat it.
081 73 48 09 09.
You go repeat them for the last time, but you no go rush.
Okay.
I beg. Take them easy. Some
Okay.
people they inside Okada keke napep now. They won't borrow biro. Some they inside motor. They won't borrow biro from driver. Some won't come out their phone from pocket. Some now ladies, their phone they for bottom of their bag. Some ladies, it they take them 2 minutes to discover their phone where they ring inside their bag. Compartmentalization. So if you are ready, sir.
Okay. 081 73 48 09 09.
Thank you very much.
Thank
Continue,
you, Ordinary
Doctor.
President. Okay, so smoking and alcohol intake is also a risk factor for developing cancer of the colon. Yes.
Musa Mohammed Abubakar, he say, my ordinary president, my own is that when I wake up in the morning or at night, I feel tenderness at my intestine region. But after waking up straight and start activity, it disappears. I know understand waiting be tenderness.
Now, big grammar in the use there. Well, we need to know what he means. Yes. And also, they should be adding their age to the message.
So if you they comment, make you they add your age, make we know.
Because there are some things that cannot happen in people less than 30 years. So you don't even bother about it.
Okay, so continue. Sir.
Okay, so then polyps. There are some people who they form polyps naturally. Polyp is a fleshy growth that occurs either in the wall of the intestine, or if it can even occur in the nose or in the ear. There are people who are they have that predisposition to form polyps. And if you have been told by a doctor that you have polyps or you form polyps, then you should be really concerned about the possibility of having cancer of the colon, because most cancer of the colon start as polyps. Let me explain that. In foreign countries, they do a lot of screening for cancer of the colon. Screening. There are two ways of doing the screening: blood tests, blood check for blood in the stool, and colonoscopy. Colonoscopy involves putting a tube with a camera into the intestine through the anus, and they look through everywhere to be sure that there's nothing. Many times in my hospital here, we have done colonoscopy for patients, and we see a small flesh just growing out from the intestine. It is called a polyp. Very innocent, not harmful at that stage. If you catch it at that stage, all you need to do is what we call a snare operation. You just burn it with diatemy, and that's the end. You tell the person come back after 2 years to see if another one has grown. But if it is missed at that time, I can bet you that in the next 5 years, that polyp will turn to a cancer. So that underscores the importance of doing regular check. Abroad, my friend came from UK to see me, Osawe. He's the one, we came together, and he was telling me that he did his colonoscopy in the UK, and they told him that in 2 years he must come back to do another one. Why? Because they have a cancer screening program there, and it is very effective. And they pick up, maybe they might screen 1,000 people, and they pick up like 20 that has precancerous condition, and they take care of it. Those 20 people that have precancerous condition will definitely have cancer in a few years if they didn't see it. You see the importance of this now. I would just make a few more comments on that later. So how do you diagnose cancer of the colon or colorectal cancer?
So
History.
that's when they push through.
Yes.
It was saying before. Now open the for open person to check that thing.
No. It's a camera and a tube.
No, before the camera and the tube come.
No.
Olden days.
No, there are two different things. This is not an operation. This is a diagnostic procedure.
Okay.
Yes, and it is in fact, it is advisable. Anybody above the age of 50 should do that colonoscopy at least once in 2 years.
Thank God I'm 30 something.
Once in 2 years. Yes. In Australia, they can even send you to prison if you refuse to come for it.
That now because for Australia now free.
Yes.
Make anybody send me to prison say I no do.
Exactly.
But the only thing be say you need to do them here.
Yes. You do it by yourself.
When sickness never go far, now then they fit treat them. When you don't go far, now Thank you. So how do you diagnose cancer? I'm sitting in my office in the hospital, and a patient come. How would I know that the patient we are dealing with cancer of the colon? First of all, I take a history. The patient will say, "Doctor, I have a swollen abdomen. Since 2 days now, I have not passed gas, and since 2 days, I have not been able to stool, or 3 days. My abdomen is increasing in size, and I'm vomiting." Those are signs of intestinal obstruction, and is the commonest complications of cancer of the intestine, because the intestine is a tube, and content must continue to go from the mouth down to the anus regularly through peristalsis. But if there's a blockage on that along the way of that tube, it's just like a traffic holdup. When something is blocking the road, what happens? There's buildup of traffic, and so everything that you are eating is not able to go down. What will happen? There will be distension of the abdomen, and then vomiting. So that's the commonest way in which we see patients in this environment, and it is sad. What of the one where beleg where they make sound? You go hear
rumbling is part of it, because the intestine is trying to push through to push the obstruction, but it's not able to.
For 2 days now, my belly they make that sound.
That yes, it can happen in isolation.
It is so embarrassing that you could make person where they near you go taste a mess, you mess.
Yes,
you never do that before.
That can happen.
You do me now.
Yes, that can happen. If you eat something that your intestine is not tolerating, it can lead to what we call intestinal hurry. Yes, or something that is, causing your intestine to be hyperactive. Yes, it happens. It can happen in isolation, but it can also happen as a sign of bowel cancer. Okay, so that's the commonest way in which we diagnose. The commonest way in which people come with cancer of the colon or colorectal cancer in this environment.
Celsius say my friend died from this disease, and he was in his early 40s. Went into remission for over a year and came back. Men don't go because of the finger they insert into the rectum. Say, na true say, una own no be finger una dey insert na no be that machine una dey.
Rectal examination is compulsory, and I teach my younger doctors. You cannot say you have examined a patient without putting your finger into that anus. Yes, you need to check to be sure. You said? Some men are uncomfortable, but it's just what we have to do. Yes.
Another way no dey.
No, there's no another way not dey.
Because even if they won't do me this kind of examination, because they talk now, you don't dey hungry me to go do. You go make sure say na woman go check me.
When we are dealing with serious matter, there's no man or woman
carry
in
finger
the
enter my window. Are you comfortable with make man carry finger like this? But if na woman, you know say na doctor they check you, abi?
Honorary President, this is a serious matter. There's neither male nor female in medical practice. We are into serious business.
You know why I talk all these things? Now the things we go make people remember this lecture.
Yes, sir.
Thank you, sir.
Thank you so much, Honorary President. So, then we examine. Sometimes when we examine, we might find a mass. Now, apart from that, the other things I mentioned before. Oh, doctor, my toilet habit has been irregular. I've been having constipation and diarrhea, and my stool has changed. You pick that out from the patient, and then they may tell you, oh, I noticed a swelling here before. So when you examine the patient, you might find the swelling. If you do a digital rectal examination, if the cancer is very low, you might even be able to pick it. You feel it. But if it's high up and it's big, if you do abdominal examination, you might be able to pick it. Okay. Yeah.
Amobi Ononiwu. He said, Doctor, I have opening in my rectum to my buttock. I have done 4 surgeries without success. What will I do? This is 23 years now.
Okay. Well, what he has is what we call a fistula, an rectal fistula. Okay. So if he comes to the hospital, we may be able to help him. So, but it's okay. Yes.
Somebody asked one kind of question, but you don't need to answer the person. Let me go read the question. Let me go answer her. Samson Orupe Michael, M.O. He say, M.O. is saying, good morning, my honorary president. Please kindly ask Dr. Otabor'S, why do patients have to pay 10,000 naira before seeing him? Now, no. We have hospitals in Abuja here. Doctors will not reach the capacity of half the capacity of Dr. Otabor'S. Before you see them, na 100,000 naira. So, doctor, you don't need to talk. We will know your word. You see, human beings, doctor, increase the money.
But they are seeing him free on Brekete Family now, ordinary president. Are they not seeing him free here?
Just because person humble himself, we supposed pay him for this appearance. We no pay him. This na doctor way from January reach this time. Some of the patients where we carry go where he treat them don't amount to over 40 million naira. He no agree collect money.
Honorary President,
una wan kill her?
You know, that woman, we're operating her today.
The woman will tell us, say, na water gather for her belly. Not be water, na growth. Tumor from her abdomen, na in they grow so. And the thing big past my head. And doctor discover, say, when they check him, other doctors check him, they say it to say she no come on time. Say she for not reach the end of this month, she for die. Doctor, Kobo, I never give Dr. Otabor'S. They don't book her for surgery. Waiting make they never even do the surgery. Now her relations will never come to sign the document for her. I don't know whether I understand. I hear say the husband come here to talk, say, they beat her, I talk, say, no be my target be that. Make the woman survive first. Woman where you abandon because she is sick. Are you a husband? No, sir. God know they live in wife. Goat wey be animal, they live in wife where she dey sick. Then you we just, and then Dr. Otabor'S, please increase it.
Honorary President.
No.
Thank you.
Increase the money so that people go come, they beg.
Let me even give you my experience.
Doctors, they collect 100,000 naira to wait. No, what thing they do. Now this one way, how much be 10,000 naira to see Dr. Otabor'S?
That's $10. Honorary President, 2012, I was in Alberta in Canada. I visited a friend, so I felt I had stomach upset. They took me to a hospital. I lie not to you. I paid $600 to see a doctor.
Which is how much? 600,000 naira.
600 Canadian, 600 Canadian dollars, which is like 500 US dollars.
So
that's what I paid.
And
just to see a doctor. When I finished,
the doctor na junior he be to you.
Who is he?
Anybody will touch my Dr. Otabor'S, he don't touch me.
500 US dollars. And when I finished, they gave me something like Nexium. I paid $400 for that medication. So I spent $1,000 right there. Then we are talking of $10. They are still complaining. Anyway, no problem. You have said it all.
I better increase them.
Okay.
Thank you.
Thank you, sir. So, how do we go about diagnosing? I've talked about the presenting complaint. Then investigation. Full blood count is very important. When we do a full blood count, sometimes this is the reason why we say come to the hospital regularly for regular checkup. Last week, a patient came to me and he was looking very okay. And I said, let's do your regular check. We did full blood count. His full blood count was about 30%. I said, he's a director, so he's wealthy enough to eat well. I said, are you sick? He said, no. I said, I'm not comfortable with this 30%. We need to probe what is happening. Because if it's maybe someone who is not able to afford to eat well, I say, okay, maybe because he's not eating well, that's why his PCV is low like that. But for someone who is supposed to be healthy and his PCV is 30%, it's a red flag. We need to probe to find out why is your blood dropping. And it can be as a result of a hidden cancer somewhere. Yes. So then we also take blood for fecal occult blood, then colonoscopy, and then of course CT scan. The CT scan will tell us the extent of the tumor and if it has spread to the liver. The commonest place where cancer of the colon spread to is the liver. Once it has spread to the liver, then the end is near.
Excuse me, sir.
Yes, Honorary President.
Eshan Kayode, he said, doctor, please, if I am in the toilet, water will be coming out of my eyes as if I am crying. I hope all is well.
All is well.
That is the poo-poo, the sweet and bitter.
So treatment. How do we treat cancer of the colon? It depends on the stage. If we get the person early, let's say we got it through regular colonoscopy, that means the thing is still young, it's still early, it has not spread. Then the aim of such treatment is to cure the person of the cancer. But if the person comes late, like most of the cases that we have in this environment, because they have been sleeping and something has been happening without their notice, then the aim would be, palliation. Yeah, because if cancer has spread to the liver, to the brain, then there's nothing that you can do again except to just make the person's life comfortable until he goes back to his creator. So we resuscitate the patient, because when they are vomiting and they are not able to pass through, they are in pains, you have to give them fluid, and pass NG tube. Sometimes we put a tube through the nose into the intestine just to decompress the stomach so that the gas will be less and all that. And then we give painkillers and all that. Then take the patient to theater. The treatments, you have to, the gold standard for treatment is surgery. This is one cancer that you don't negotiate surgery. And the earlier you accept surgery, the better. Because I found out that a lot of our people, when you tell them you need surgery, they play the ostrich. They go away, and some they will just disappear to traditional medical, attendants. Some will just go to church. Some will go to Alpha. They go to do different things. By the time they are coming back, they are 10 times worse, and they have lost their best chance of being cured. So, for cancer of the colon, it's not negotiable. So you know it from the beginning. If you are ever told that you have cancer of the colon, the earlier you submit yourself for surgery, the better the outcome.
Okay. A son Kayode, he said, "Doctor, please, I'm above 50. Should I stop meat completely so I can face fish?"
Yeah, that's a good option. If he doesn't feel that will take something away from his life.
And
yes.
Okay, doctor, don't talk your own. Me, I go tell you again. Even the fish, this our fish, where we they rear, where then they call catfish, is full of fat and oil because of the antibiotics, the kind feed where then they feed them. Please, even the fish, make una dey careful.
Dried fish is better.
Una don't hear.
Yes. Okay, so during surgery, when you open up the patient, you are going to cut out the segment of the intestine that is affected. You are not just going to take that part. You take give it some distance and so that you take normal tissue away. The question of whether the person can survive, yes, can survive very well. The way God made the intestine, He made it with so much allowance. You can even survive. You can even survive with half of your intestine. Yes. So we'll take a good segment away so that we don't leave some portion that will leave cancer behind. Okay. We take it out and join, and then.
Excuse me, sir.
Yes, ordinary president.
Good morning. Feko talk say, "Good morning, my ordinary president. Please, can eating too much beans cause the same problem, please?"
No.
It's a doctor talk say no. Continue.
Okay. So after the surgery, sometimes we are not able to join at once. We have to, after cutting out the segment of the tumor, we have to bring the intestine out to the surface, like that young man that was here some time ago, where the intestine was brought out, just so that the whole area would be okay before we can now take the patient back and join. That's what we call colostomy. Then after we have treated the cancer, you don't just go away like that. If you go away like that, in 1 year, the cancer can come back. And by the time it's coming back, it might just come back as yellowness of the eye. That means the liver has been affected.
Oh, no.
Yes, so you give yourself to further treatment, adjuvant treatment. That means chemotherapy, it could be radiotherapy or whatever. It's the oncologist that will determine what next step is needed to be taken, as a follow-up treatment for cancer. That's the much I can say for the purpose of this discussion, yes, in terms of the treatment.
Raji Shoaibu say, "Good morning, my doctor. Please, can a sister inherit cervical cancer from a sister, or is it only from parents? Cervical cancer."
I think he needs to understand how it works. If it's in terms of hereditary, then it can only come from parents.
Okay, not sister.
Yes, can't come from sister. Okay. I have some pictures on the screen. I would like just to do some illustration. I don't know if they can show them.
Oh yeah, show now.
Okay, so now that is that's the wall of the intestine has looked. The camera is looking at it now. I don't know if people can appreciate it. Yes, so that the one on the lower left side is the cancer that is just coming up. Yes, it has not grown to cover the entire circumference yet.
At least I'm never remnant of poo-poo.
No. Okay. So if you catch this at this stage, it's still an early cancer. This one cannot cause intestinal obstruction, because the part of the circumference that has been taken is just small. Yeah, so this one is curable. You can just cut that segment and join, and then that will be it. Next slide. See, this one has almost covered the entire intestine. So this one is advanced. So this one, after cutting and joining, you still have to, you have to look into other areas, because this most likely has spread. Yes, next slide. Okay, so this one, you can see the upper part of the screen. It is like almost 50%. Yes, so that what you are seeing up there is cancer of the colon. Next slide. This is a clean colon. When you are doing colonoscopy for patients and you are seeing it through like this, when you are done, you shake the patient and say, congratulations, you have a clean intestine, come back in 5 years. Yes, because it's clean. Okay?
Doctor, shake me. Una dey clap. Now wish I dey wish so. We are good at wishing our problems away. Una not supposed to clap for me. I don't go do the colonoscopy. No. Why is he shaking me? Because I want to trigger this kind of sentiment. Instead of us to work towards solving our problems, we wish our problems away. Some people go discover this kind of thing. They they take herbal medicine. I don't know whether I understand. Some go they collect anointing oil. Some go they collect rubutu from Malam. I don't know whether I understand. The same pastor where they give you, if you get this kind of thing in a hospital, they go. The same sheikh or malam will give you that rubutu. If this thing happen to them, in a hospital, they go. So I do them intentionally in order to give you this message. Continue, sir.
Thank you. Okay, so let's go to the other slide that was on now. Okay, so this is just an example of how everything starts. On the left side, that tiny one is the polyp that is very innocent. It's not a cancer, but that is how it starts. Just a small flesh growing down from the wall of the intestine. Then over time, as the years goes by, it increases in size. If we catch it at that stage, all we need is to burn it, and that's the end. And it doesn't take more than 300,000, 200,000 to solve all that. But if it is not resolved, then what you have on the right is what will happen, and that's cancer of the colon or the rectum. And that's already a big deal. See, you see those blood vessels around there, those bluish and red, those are blood vessels. They are the ones that take the cancer cells from there to the other parts of the body, like the brain, the liver, and the lungs. Next slide. Okay, so on the slides on the left, it just shows you the area where that cancer is. But when they zero in now, you see how the cancer looks on the right. Can you see it? Okay, next slide. Okay, so this is just an illustration of the way cancer is that's the colorectal junction. Next slide. Okay, so that's the one on the right down. That's just how the cancer is represented. Okay, so I'll talk. Okay, so that's the tube, the colonoscopy that we use to check through the entire intestine to be sure that everything is okay. Majority of the people will be fine, but if we do like 1,000 patients, we may get like 30 patients that is already in trouble. So we solve that problem for them and they're happy. Then you keep quiet for everybody to go through, and then one day you see that there's already trouble. So for screening for bowel cancer, I am recommending to the Minister of Health and to our government to set up a national bowel cancer screening program. I know that they would say that there's no money, but it's actually cheaper to catch this early than to treat it. And that's the economic sense of having a screening program. Yes, though we're a resource poor country and we don't have the money, but we can be penny wise and pound foolish if we leave it unattended.
Binam Abua, he said, "Thank you, my ordinary president, for changing my life with the presence of Dr. Otabor'S in the studio. God bless you." You mean say maybe doctor don't talk waiting concern, waiting the warrior. Make we appreciate doctor again. Yes. Sorry, say I dey interrupt you from time to time.
No, it's okay.
Know, say we no go school. You get the way with the understand things.
It's okay,
and we go
sir.
soon open telephone line. Una wait there for studio, una go ask question. People wait there outside go ask question too. Yes, if you dey okay by
No, very fine.
Okay, sir.
Sir, it takes for lower GI endoscopy on maximum where you will, maximum for that test anywhere in the country will not be more than 200,000. In my place, it's far less than that. Okay, but that's for you to detect this thing and solve it. But if you are going to treat cancer of the colon, especially the advanced one that has come with intestinal obstruction, if you end up spending 20 million to treat it, that means it was really not a bad case. So you can see the difference. You can see the cost effectiveness of early diagnosis. And that's why in advanced countries, they invest money on the screening program. They know that if they screen the whole population of, let's say, 50 million people, maybe not the whole, well, maybe 20 million, because the age, there's an age restriction between the age of 50 and 70. Maybe the total number of people in that age category will be 5 million. And they have budgeted money to screen those 5 million. What they will spend to treat only 50 people that would end up with cancer will be far more than what it would take to screen these 5 million people.
That is if the government is concerned about the masses.
Yeah.
It is only when the government is concerned that they will be able to do this.
Yes, you are right.
Make I read some. Somebody say, my ordinary president, I normally go to toilet 3 times in the morning every day, and my toilet is always not watery.
That's okay.
It's not watery.
He said it's not watery.
And if they go 3 times.
If that is normal for him, fine.
3 times in the morning.
If he has been doing that
okay.
If he has been doing that for 10 years, who am I to come and stop that?
Okay.
It's okay. That's his habit. There's no definite number of times.
Okay.
Anybody. It may be the way he trained himself.
Okay. Somebody say, Simon Leah, he said, good morning, my ordinary president and our doctor. God bless you. Please help me ask doctor if his hospital is operating with NHIS.
We are registered with NHIS for primary care. And you know, primary care is just cough and catarrh. And they don't take anything that is more serious, we refer. Yes, because...
Okay, Esther Uka, I say, good morning, my ordinary president. Please, I am 52 years old lady. A 52 years lady. For some time now, I've been experiencing slight pain in my left side lower abdomen. Am I under any threat?
How many years?
52.
No, how many years? How? He said for some time now.
Yeah, for some time now. You know, indicate, make una they
yes, she should go to the hospital for a simple scan. That can help, or just an examination. Okay.
Mary J. Paul, he said, that is right, doctor. Yes, everyone is screened for cancer here in my country. Mary J. Paul, we go reach there one day by the grace of God. Okay. But okay.
Just 2 minutes to conclude. So I'm going to talk about prevention. Prevention is always better than cure. And how do you prevent cancer of the colon or colorectal cancer? Healthy diet with plenty of fresh fruits and vegetables. Reduce red meat. Well, I say reduce. If you have the grace to stop it, fine. But reduce it. Don't be doing it every night. You must eat suya. Maybe once in a while, you can take that. There are other options. Chicken is not red meat. Offals is not red meat, like intestine. Fish is not red meat. Stockfish. There are so many more options that you have. Then avoid, especially the processed red meat. Avoid smoking and reduce alcohol, and improve physical activity. You cannot underestimate the place of exercise in prevention of cancer. It is too important. I have come here to talk about at least 4 different types of cancer. And in these 4 different types of cancer that I talked about, exercise featured in all of them as a way of reducing the chances of getting cancer. So by way of prognosis, which means what is the outcome like? If someone is diagnosed with cancer of the colon, or colorectal cancer, what is the future of the person? It depends on the stage at which we catch the patient. If we catch the patient early through the screening program or maybe incidental finding, then maybe just through even just checking blood for occult blood, stool for occult blood alone, it's a cancer screening. Yes, just please, doctor, check my blood, my stool. You submitted your stool. They check if there's blood there, then they want to probe further. That is even a very cheap way of doing cancer screening. You don't have to even do the colonoscopy. You know, so if it is caught early, prognosis is good, survival is excellent, and cure is possible. But if it is late, then we're just talking about palliative care. It's only a matter of time. Thank you, Ordinary President.
Yes. Peter, good morning, Brekete family. My question goes to my own doctor, Dr. Otabor'S. My own. I am only 42 years. When I wake up every morning, I always use the toilet. My wife don't give me nickname, shit master. And Kehinde Adedeji say, good morning, my ordinary president. My name is Dash from Dala Kano. Dr. Otabor'S was our doctor before. He did his training in Dala Orthopedic Kano. Good job, Kakaki. They call him Kakaki. Julius Okongo, he said, Doctor, thanks so much for this information. Make we appreciate Doctor. Fadila Fapus, he says, please, I need more insight on pap smear. I am 42 years. I have never had it done. My mother never. My grandmother, my aunties never did. I researched on it, still not convinced. I know one use my hand by market. Pap smear.
Okay, so thank you for that. That's an important screening tool for women for early detection of precancerous condition in women, cancer of the cervix. Cancer of the cervix is one of the commonest cancer in Nigeria, and it kills women so rampantly, just like breast cancer. If not even, some studies shows that cancer of the cervix is even commoner than breast cancer, but people don't know. So you find that a woman who has passed menopause just comes back to you today and says, doctor, I've started seeing my period. It's not period, it's bleeding from cancer. So, and from that moment, it's just short time. Yes, she's going. So, to prevent, we can catch that cancer early if we do what we call pap smear. We just take a swab of the cervix and take it to the lab and look at it under the microscope. It will tell you if everything is okay. If everything is okay, they tell you come back in 2 years to do another one. But if it is appearing like the cells are behaving like dada, you know, they are behaving like abnormal, because the way cancer the way God made the body, our cells are supposed to be dividing and arranging themselves in an orderly manner to form tissue. But when cancer is about to start, that normal pattern, that normal orderly pattern will begin to change. You now start seeing You now start seeing some. It's like house face here, window face here, door face here. Everywhere is now becoming scattered. That is a sign that cancer is about to start. And if you catch the woman at that stage, all you just need to do is to go and sweep that place. There are chemicals to apply, and it ends.
But you know, our problem here is some doctors where you see for Nigeria, now the ones where no fit run come out. And those ones where no fit run come out, the ones where decide on their own, say they know they go anywhere, the ones where no fit come out of frustration, be then deny them visa or something, those ones now money then they look for. They call them alarmist. You come, just because they won't collect money for your hand, they go raise one alarm for your head. You go begin they run helter-skelter. They look for money where you go give them. See this one what happened for Lagos now. You understand? It to say God give them the money, therefore don't kill this man according to waiting they discover for Federal Medical Center Jabi here. Woman go day labor. She just the woman is strong. Every position of the child is okay. The woman is ready to deliver safely. Some doctors, all these small private clinics for Angwa, they go send a CS just because they won't collect money for CS. So, sir, how we go take even are they confused, sir?
Honorary President, I've been a doctor for 24 years. I've not seen a stupid person that succeeded to become a doctor. Patients can give their own opinion about doctors, but I like to be objective. I don't agree that it's only those who are not smart that have remained back in Nigeria, or the greedy ones.
I know talk, so make you hear me.
Yes, sir.
I say you get the ones where decide on their own, say they know they go anywhere. Yes. I say those ones they. You get the ones where been one go, they no fit to go. Frustration pin them down. They still there for Nigeria. Now those ones be the ones who will be say every small thing na money.
Sir, people bring in their personality into medical practice. For instance, as a pastor, I cannot remove my practice from my persuasion as a pastor. Naturally, I have that milk of human kindness. I have decorum, and I may not really be afraid of some things the way my other colleagues will be afraid of it. Even during operation, sometimes accident happens. You enter into a major vessel and you see blood come out to the ceiling. A surgeon who is not very bold would lose concentration, and that can lead to something. But if you are calm, you can arrest the situation. So the personality of the individual also come to play when you are seeing a patient. Yes.
So if person will be native doctor before he will become medical doctor now. Okay, so continue.
Yes, and judgments differ. Even in medical science, two different people equally qualified, they have two different opinions about a particular case. It's just a matter of opinion. That's why a second opinion is also sought. The very fact that the doctor in Lagos said they wanted to do a particular surgery, and another one here says they want to do something different, it doesn't mean that the doctors in Lagos are stupid or don't know what they are doing.
No, it depends.
It's because the doctors in Lagos they are also looking at some things.
I not be here. We get doctor we rise to the director of the rank of director for Federal Ministry of Health, and he no be doctor.
Those are very rare cases. In Lagos University Teaching Hospital, it's a teaching hospital, and there are cadres of doctor until it gets to the consultant. So it's not one person in one small corner making a decision. It goes through a lot. So I don't have the fact of the case. So I cannot.
No defend.
Yes.
You know fit defend.
Thank you, sir.
Thank you. Anybody get question for studio? Yes, my elder from the International Institute of Journalism. Borrow that other microphone, the second mic.
Ustaweke, International Institute of Journalism. You mentioned about cases under 50 that are rare. What is the statistics in Nigeria, and what are the causes of young people getting this type of cancer?
Okay, thank you, sir. Yes, you're right. It said that cases of cancer, of bowel cancer under 50 is about 10%, but it's dynamic. The numbers are changing as society is evolving. But the commonest reason why people have the commonest risk factors for people who have cancer of the bowel less than 50 are those who have genetic predisposition and those who have polyps, those who naturally form polyps. You have plenty polyps in the intestine. We call it polyposis. They are everywhere. The tendency for one to quickly turn into cancer is very high. So those are the two major factors why you are having you may have the cancer of the bowel in people less than 50.
Okay. Yeah. Any other question? Okay. That lady over there, that my widow. Before the mic will reach her, he say Augustine Kachiro. He say, "Good morning, defender of human rights ordinary president and Brekete family, both home and abroad. I am 45 years last week. I go to poo-poo. My poo-poo is like monkey poo-poo. Ball. After that, some days later, dysentery follow. So, who don't ever see monkey poo-poo? Say ball. So, after that, some days then dysentery follow. Whether you get
she should go and check herself.
I don't know whether a man have been but Augustine Kachiro.
Augustine should make sure he sees a doctor.
Okay, thank
yes.
you. Yes.
Good morning, my ordinary president. Good morning, Brekete family. I have 3 things that I want to...
Doctor, you ask question. Address
okay. Oga Doctor Otabor'S, I have 3 things that is disturbing me. I just want to ask, because I went to scanning for the first time. They tell me that I have fibroid, but I did not feel anything like something is paining me. The first one about poo. My own, like, sometimes I will reach 1 week before going to
way.
Apart from that, I don't know what is happening. Apart from that, like, if I see my time.
Who be that person where we are blue, the way they signal somebody to come out? Who be that person? Eh? 9 day bounce, they do somebody signal, make them come out. No, I no blame una. Now access where una get. Una go come back here, see how una go take enter studio. Now me won't do on each nonsense here for. Continue.
Okay, the second one is that if I see my time like 3 days, if I mistakenly dream months, blood go to flow for my body like I born a baby. You go to flow even though the brain rack.
Now by force to dream what?
I don't know, sir.
You get one person where to say anytime when you dream mineral, they see blood for him poo. Now by force to drink mineral, when I don't ever see Oyibo they do party where they drink mineral. Even Oyibo where they work for mineral company, whether Coca-Cola, Pepsi, go to their party, you know go see them they drink mineral. Why una go they drink mineral? That in the weaken person bone, it they weaken a lot of things, including area 1. So, doctor, answer them.
Okay, so
the third one is
this,
about.
You have mentioned 3 now.
No,
maybe the fourth one.
Add them quickly. Time don't
Okay,
go.
if somebody urinate or if I go to this gidan wanka like if I want
Public
travel,
toilet.
if I sit down before I get up, if I discover that the toilet is dirty, if I just get up, my tummy will be crying like that.
Fear. Anyway.
Honorary President, I should give you a diploma in medicine. You are just spot on. So let's start with the last one. It's just psychological. Yeah, so your autonomic nervous system is activated. So that's the same thing that makes people to want to run, or sometimes when you face tension, you say, excuse me, I want to use the toilet. Your intestine will be in a hurry. It's just as like that. It has nothing to do with any disease. Then concerning the 1 week, you say for some time 1 week you will not go to toilet. Yes, constipation is common. Depends on whether you are taking enough water or what you have eaten at that time. So it's encouraged for you to take a lot of fruits and vegetables. And people who are a lot of people mistake how to get the best benefit from fruits. If I said go take fruits and you go take orange, you peel it and you suck it and you throw it away, then that's the wrong way to consume orange. What you have thrown away is what you should be eating. In fact, the sap, if you like, you can even throw that away. That's what you are sucking. That is not as important as the flesh. So if you are going to eat orange in a nice way, just peel it and eat every other thing. Okay? So plenty of fruits, vegetables, it will help you to move your bowel faster. Okay? Then concerning fibroid, yes, you said you don't feel anything, you don't feel sick, but they say you have fibroid. Yeah, it happens. Just the way majority of the people who have cancer of the colon would not even feel sick at first. But the thing is growing there. So it's possible that your fibroid is small. It's not as big for you to be able to feel. For you to be able to feel your fibroid, it must already be big to an extent. So
no wait for them to be.
Yes, so if they say you have it, fine. But if it's not stopping you from having children and it's not causing you pain, it's not increasing your bleeding, then can leave it alone. The only fibroid that we treat are the fibroids that are causing problems.
Now, sorry, you get one research where I do. I no be medical person. I go demonstrate am here and I go tell you now. Then if doctor gets scientific counter, make a counter am. No, the microphone. You see this modern toilet where Oyibo carry give us, no problem. Yes. Based on my research, I no be medical doctor, but it gets scientific element inside the research. You see this our olden days toilet where you go do like this. If you see the body anatomy of person, you go see say even the movement of the poo, this thing, it dey aligned and it go dey easy to come out. Some of us where they suffer fibroid, pile. Now as a result, because some of the bucket where they take do that toilet, it go come, you will go to poo. Now you can't come compress the mouth like this. That now another struggle before the thing go come out. Better mess, you no go fit mess am. But some of us where sabi bush poo before, when you do like this, the first thing mess go come out, you go clear ground. No be say I dey encourage bush poo again because it dey cause cholera and the rest. But make I tell you now, if me now I won't build any house, if I put this one because of visitor, I go do that one where they flat, where if you finish you go still flush them. But as you dey like this the whole day down, you go hear tolom some self you go land them here. When you flush, you think go flush and you hear po. Good idea, yes? So
yes, sir.
If you, and you see squatting to go to toilet, it dey elongate the health of your joint here and your back, because na exercise. Now make Fulani. Because of this, they are greeting. Aku, na walijam, na shauri, na jodi, na this. Then they last with their knee. Their leg and their knee they strong, their back they strong. Why? Because then some people no fit remember when last they squat. They only squatting now during prayer. I don't know if you understand. Some people cannot go down like this and stand up like this. Some go need to touch ground. And not be old people, though. Young people. You come here. You will want to join civil defense. Come here. Sorry, doctor. Stay with me. Are you ready? Let's go. Let's go. Let's go. Stay like this. Remain. Let's go. Let's go. Stay like this. No, go down. Come. Let's go. Let's go. Now, I don't want your heel to go up. Thank you. Now you go know whether you go squat. Don't allow your pom pom to stay like this. Boom, 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 boom. Let's go down. Boom. Let's go up. Boo. Boom, boom, boom. Let's go down. Boo. No. Let's go down again. Boo. Then up again. Boo. Then let's go. Some of them not fit do them.
Yes, sir.
It is part of exercise. It go strengthen and your poo go come out. Some of the majority of the people where they suffer pile, apart from the food, where doctor talk, the way una they go toilet, this bucket where would they sit down on top, no problem. Once you sit down on top of that thing past 3 minutes, problem day. If you take on top of that toilet, reach 7 minutes, 10 minutes, the next thing, back pain. Una never notice, huh? Thank you, you can go back.
Thank you, sir. you earlier said to us that you have common sense. You have confirmed it again. I don't need to add anything. You are so spot on, perfect. Thank you.
Adizat, over to you.
Yes. So, ordinary president answered the question on when you drink malts and your period. Stop drinking malt. Simple. Okay.
Udioje, he just sent 20 pounds into Brekete Family account via YouTube. Odion Uduoje. Thank you. Yes, ask your question quickly.
Yes,
we will soon open telephone line.
Good morning, doctor. Good morning, my ordinary president. My own question be say I want to know which gender they prone to this sickness more, and also the age range where person they prone to them.
That's what we see. Is it this?
The colon.
Okay.
Cancer,
Yes. It's the male is slightly more than female.
Okay.
Like
thank God.
Yes.
Thank God.
Like 52 to 48%.
Okay. Sir.
Yes.
So they
in
catch
terms
men
of the
pass,
yes, men more, a little more than female. Yes.
If they catch men pass women back,
yes,
he good like that. Make we clap.
Yes, sir.
Make we clap for the sickness.
In terms of the age, I've said it from between 50 and 74. So those are the critical
never
age.
reach there.
Very,
Yes.
very.
Okay, the number to call if you dare for inside Nigeria now 090 99 88 77 00. If you dare for outside Nigeria now +234 81 88 89 1011. One woman there for back, give her a microphone. Madam, come front quickly. Yes.
Good morning, my ordinary president. Good morning, doctor. Mine is a kind of appreciation. I was referred to your hospital.
Cameraman, capture him now. Capture her. What did she do you?
I was referred to your hospital by one big organization in this country because they only believe in good hospitals in that place, CBN to be precise.
Okay, CBN referred you to his hospital.
Yes, sir.
Were you treated nicely?
Yes, sir.
Are you happy?
I'm very happy. I was having pains all over my body, all over my joints, especially the knees.
You got that camera by the side.
So I was diagnosed arthritis. So doctor told me that if I can avoid meat, that it will help me. And that was 3 years ago.
And you avoid the meat?
I stopped eating meat.
How far now?
So I don't feel pains in my joints again. I can climb any upstairs and no pains.
So you can climb anything now?
Anything, sir.
Okay, thank you. How can I clap for her? Somebody there for front, we won't talk.
Thank you.
Good morning, doctor.
Morning.
You are once my mommy's doctor, and I appreciate your works.
Thank you.
So my question is, sometimes I do have like a swell up in my armpit. There is a time I came to you when I came with my mom. So you gave me some drugs in which I take it. I'm okay. But as for now, sometimes once I feel like a ball like this here, before you know it, I'm trying to use my finger to press it in. Once it stops, I feel stomach pains. So I don't know.
Well, okay, you need to come to the hospital to see me.
Simple.
If you can come in today, I'll be going to the hospital from here.
Thank you.
Let me take a more detailed history and check you properly.
Thank you, sir.
Hello,
good
sir.
morning. Nahumi and I'm Devano for radio and TV telephone.
My name is Christian Obiwanye. I dey call from New York. Belembe.
Oh, no. Christian Obiwanye from New York.
From New York, yeah. Good morning, Dr. Otabor'S.
Good morning.
My own question does be very quick. My mommy back home, they always complain of, say inside her body, she dey always feel discomfortness, and this thing will cause sleepless nights for her. I don't be seen that go hospital every time, but then they give her medication. She could just come back after some time and go start again. So, which will be your advice on that? Thank you very much.
Okay. Before doctor go answer that one, we'll go gather a question for him. Emmy, he sent $9.99 into Brekete Family account. Let's appreciate. They call this thing super chat. I've been be super chat via super chat. Yes. Hello. Good morning.
Good morning, my ordinary president.
Now, who me and I've been a Kenneth Eze, the argumentator.
My ordinary Kenneth Eze, okay, the argumentator. Only good answer, I greet you, sir.
Yes, where you ever know from? Vancouver.
My ordinary, they coming from Vancouver, Italy. God bless you, ordinary.
Amen, and you too, sir.
And I greet Otabor'S, our good doctor. I thought it treats you well. You ordinary, you are welcome home. Dr. Otabor'S, we thank you. God bless you.
Thank you, sir.
My ordinary, I only got to say thank you. You see, you are not Otabor'S. The way that two they do. That man, honestly, this is why they teach our people. You know what for us people, which is a government duty to do those kind of things. To bring the citizen, like as I dey here now, at my age, they send me paper, come do control of many things. Before I go start to work, at least every year, they send me paper. They come check your body, which are they do. But this man, they do only on his own through you. God bless all of us.
Amen. Thank you very much. Thank you. Amen. Hello. Good morning.
Good morning.
What's your name? Where you live from, sir?
My name is Said. I'm calling from Egypt.
Yeah.
My name is Said. I'm calling from Egypt.
From Gudu. Oh, from Egypt.
Egypt.
Okay, waiting be your contributor to from Egypt.
We thank you for everything you are doing for humanity.
Thank you, sir.
We just under Allah reward you.
Amen.
And your generation. We thank Dr. Otabor'S for the lecture to give us this morning. We really appreciate.
Thank
you. So what I want to talk about is that this policy you are talking about, you mentioned to this holding toilet and this new one. Hello?
I did hear you.
So the holding toilet, because I didn't even know that this lecture will come out today. Last week I was sitting, I just remember the holding toilet. If you go in the morning, every morning, if you go to the toilet, the only open toilet, you'll be seeing something smoking going outside from the toilet. Is it not bacteria that will cause it may be causing damage to our health or all this thing? So those days, there's nothing like that because we always use that toilet.
Okay, thank you.
So I was just thinking that nowadays we are using this normal toilet, the open toilet. With this smoking, there's nothing like protection.
That olden days toilet no get where breeze they come out, but this ones they get I don't get waiting then they call them. Doctor no go answer this one because he no concern her. Hello, good morning.
Hello, good morning, my president.
What be your name? Where you develop from?
I'm developed from Niger, Agadas.
From Niger, Agadas.
Yes, sir.
Angai Sheka Namiji.
So I'm Nigerian.
Okay. So.
Thank you for bringing Dr. Otabor'S to studio. And we would appreciate you always to open Nigeria to educate us, we as a Nigerian. You see, it is only good people like good things.
You see, some people they are complaining about to see Dr. Otabor'S, you have to pay 10,000 naira. Me, I guarantee you, there are hospitals in Abuja where I know. Before see the doctor, you must pay 200,000 naira before see the doctor.
Junior doctors.
Junior doctor will give you a normal result. To see the doctor, have to pay 200,000 naira. Me that I'm talking with you like this now, the place that I'm working in Abuja, just close to the hospital. I know everything about there.
Thank you very much.
So those people that they are complaining about, it is only your element that cannot like what you are doing, but we appreciate you. And
thank you very much. Hello, good morning. Hello, good morning. Good morning.
Hello.
Good morning.
Hello.
Hello.
Hello, Daddy. Good morning.
Good morning.
Good morning. It's me, opportunity.
Opportunity.
Hello, fine. Daddy, I get question where I want to ask Abenove.
In they hear you.
Now, opportunity from Amsterdam, Holland. Yes. About now, so this thing. But Daddy, I want to ask Dr. Otabor'S. Daddy, may you answer me. We need when they want to bring physiology doctor come studio.
Physiology.
Yes, physiology, Daddy. With the Women Association, we need them because maybe they also explain to us why our men they fumble sometimes. What if they make them be 10 seconds, 20 seconds? We want to know with the Women Association, physiology doctor.
Okay, thank you very much. So, madam.
Sir?
Una want to know why some men they do 10 minutes, 15 minutes, Abi?
Yes, seconds.
Oh, 10 seconds. Yeah.
Yes. Waiting where I've been waiting that they drink or waiting the cause for them. We want to know, we need the physiology doctor. Make us explain to us.
10 seconds, Abi?
Yes, 10 seconds is not good.
Okay, thank you very much. Thank you. Hello, good morning. Okay, doctor. Look, we take this one before.
Hello,
Antonio Bebo.
Hello, good morning, Ordinary President.
€9 99.99. Yes, good morning. Waiting be your name, sir.
Mazi from Italy, Ordinary President.
The Hausa Igbo man.
Ordinary President, good morning. Not they call you double doctor, double ambassador. You has Dr. Otabor'S give you a diploma in doctor. Ordinary President, I want to just add waiting this our brother talk. In Cairo, I go to Egypt this year to see this doctor. Ordinary with queue with your money go to bed. So waiting the 10,000. If you say you want to see
10,000 naira.
If you want to see a pastor, yes. If you see you want to see a pastor, how much you want to give her, or bangle or checks? The not thing you say make you even buy checks for Dr. Otabor'S or bangle, or you want to see imam or you want to see anybody. Just for your own good, your health. And here all they talk here, you go. Ordinary, so all people where they work for this Europe, if you see the way they collect for doctor, you must pay a doctor, whether you see him or you don't see him. You must pay a doctor for inside your tax.
Oh, thank you very much.
No, thank you,
Thank you, Jamilu. From Mazi Jamilu from Italy. Hello, good morning. Good morning. Good morning.
Good morning, sir.
Yes, waiting be your name. Where you Devano from?
I Devano from UK, Scotland.
Okay, waiting be your name from Scotland, sir.
My name is
Benson from Scotland. Dr. Otabor'S, they hear you.
Yeah, okay, sir. I ask of about this. Sometimes I don't know. Your feet, what's called small,
Waiting go come the small.
That is your private, and your feet.
No, your own.
Yeah, my own.
No, but truly, Maybe not the same thing where they happen to some people where they shout they don't thief my pennies, they don't thief my pennies be that. You understand? Doctor go explain. If a doctor know if it explain, we'll go bring native doctor to come explain. So once in a while, they like say the thing they shrink go inside the bank.
Yeah.
It they happen to me sometimes. Who it never happen to make you raise your hand. It gets sometimes where you go tire. You know go the air where they inside no they complete. You go there mede. You know the thickness no go thick like before. Even the helmet no go big. You understand? But nobody doctor go answer. I just answered you.
Okay, so I still get one other more question.
Oh, yeah, talk him quick.
Yeah, that is if I want peace sometimes, if I want peace or I want shit, I will just they pass out like hair, you know. You know, that's why I did mess.
The mess they plenty. I think only one mess.
Huh?
You the mess na plenty mess. I been just once poo you.
No, just one.
So as you the urinate now, before the urine time, the mess they come out. I be during the urine. I be after urine.
No, before the urine.
The mess go come out. During the urine, mess they come.
No.
You dey chop beans where?
Yeah, the shop is not the most.
You dey drink milk where?
Yeah, I dey drink milk.
And they cause the mess. So, but make you go treat infection. No, go make them check you for hospital. Make them run test on you. Infection they reduce the size of catapult.
Okay.
Go do infection. Doctor, they come back to you now after this one. Hello, good morning. Good morning. Okay, announcement. Mr. Adeoye Adelariwo entered a taxi from car wash along Airport Road, Lugbe, to Otabor'S this morning, being 3rd of November 2023, around 10 a.m. and forgot a black bag containing some new clothes he sold for clients. He is and other valuables personal belongings. And the motorway he enter na Toyota. Okay, he's a tailor. I bet anybody will get useful information. I sure say the taxi driver they listen now. I beg Mr. Adeoye Lariwo, he enter your taxi this morning from car wash by Lugbe. You can't drop for where? Otabor'S. I beg that black leather when they forget inside. No be in things. Nah, things way is so for tailor and for clients. I beg no vex. Thank you very much, doctor. Make we take one call then from Nigeria. Hello, good morning. Good morning. Nigeria pick, call, talk. We go take another one from Nigeria again. Hello, good morning.
Hello.
Yes, sir. Waiting be your name. Where you develop from? Waiting be your contributor.
I come from Bowel.
Yeah?
I want to make you help me.
I hear you.
I go to hospital at Abuja. I go to cover there. My hand is not work.
Your hand? Now stroke do your hand?
Yeah, too. The
let's not treat you now, native doctor, now native medicine.
Not now doctor.
Medical doctor. Oyibo doctor, I be native doctor. Garki hospital. And up till now, your hand no dey work.
Well, work.
Then they do physiotherapy. Then they come massage the hand for you regularly.
They go to at
where this woman we do this our sister own this herbal woman.
Yeah?
One woman go announce her phone number now. Make you pick the number. She go if you and her settle. You go pay her. She go can't do. By the grace of God, you go use the hand go work. Madam,
Sir?
what be your name?
My name is Peace.
Where is the microphone there? Oh
It's
yeah.
in my hand. My name is Peace Israel.
I beg give us your phone number. Now you be the woman where they give supplement for diabetes and high blood pressure, ba?
Yes, sir.
Okay. So give us the phone number.
My number is 081 42.
Calm down first. Make we do.
Yes, sir. 081 42 36 32 07.
Repeat them again.
081 42 36 32 07.
Madam, step out, make you go answer your call. Our sister wait there for studio. Make we give her the microphone. Give her the microphone before Madam go come out. Make she attest to this woman physiotherapy. Give her. Madam, wait. Abe sister.
Sir.
Now I hand over to this woman for physiotherapy.
Yes, sir.
And as she do you, how you they feel?
So, thank God for everything. The leg, or just the hand. I never feel use and carry anything for
But
now.
the leg don't they improve?
Yes, sir.
This hand and leg weight on they there for how many years?
4 years.
4 years.
Yes, sir.
When she start this treatment on you, it don't reach 2 years?
No.
It don't reach 1 year?
No, sir.
So you know go thank God say leg don't they work. Make we appreciate this woman. The 100,000, the 50,000 naira weight they send on behalf of Abe, I don't give you.
Yes, you don't give me, sir.
I dash you 50,000 naira. They don't give you.
Yes, sir. They don't give me, sir.
You can go
I
from here.
appreciate.
Make we appreciate her. Collect the
Okay,
microphone.
thank you very
can
much,
go.
sir.
Thank you.
Yes, sir.
Make una escort her. Make she come out. Thank you very much, doctor. After this last call now. Hello. Good morning.
Hello, good morning, my other president.
Waiting be your name. Where you develop from?
This is Chika calling from Switzerland, your grandfather.
Okay, from Israel. You say
My
your
other
grandfather.
president, good morning, sir.
You say your grandfather.
I'll be
your grandfather.
I'll be your grandfather,
Your
my
grandfather.
other president.
Your grandfather. Your grandfather. You know?
My other president. My other president, sir. Good morning, sir.
Good morning, sir.
May God continue. May God continue to bless you, sir.
Amen.
May God continue to bless you.
Amen. And you too, sir. Thank
And bless Dr. Otabor'S.
Yes, sir.
You see, for here, we waiting in the do. Waiting Dr. Otabor'S they do now exactly waiting government supposed to do for each citizen. But here we would say, if you be citizen, if you reach 50 years, then go write you, then go send you a letter to come do this test when they talk about now. You know, here in Switzerland, that is what they do, just to confirm waiting. Is the work talk, you know. Kenneth is the work. It's the same thing they do here too in Switzerland. When you reach certain age, then go send the letter, may come do a particular test. It's compulsory, and you know go pay shishi. So waiting Dr. Otabor'S come talk this morning. My other president, may God continue to bless him.
Amen.
You know,
thank you, sir.
for the man a blessing to our generation, blessing to our country. You know,
to humanity in general. Thank you, sir.
To humanity in general. Thank you, my ordinary president. May God continue to bless you.
Thank you. Amen. Make we appreciate her. Yes, now back to the studio. Nonye Stella, he said that woman is not appreciating. I see him. I see him. Say the hand never begin the work. Shebi, not be the same person where they jumped the other day.
Yes, sir.
Dr. Otabor'S.
Yes, sir.
You they see what they see. Well, now back to you, sir.
Thank you. There are a few questions here I would attempt to answer. One of the listeners said his mother is having general body pain. I presume she's quite elderly. There are many reasons why elderly people will have pain. Yes, ranging from joint arthritis, multiple joints inflammation, or even osteoporosis. I talked about osteoporosis here some time ago.
Which one be osteoporosis?
Softness of the bone that comes with age and lack of exercise. Yes, so
that comes with age and lack of exercise.
Yes.
What do you call them?
Osteoporosis.
Osteoporosis.
Osteo means bone. Porosis means soft. That's porous.
Osteoporosis.
Osteoporosis.
It comes with age and lack of
exercise.
I'm going to continue, doctor.
Yes. So there are many reasons why mama may have body pain, but if she sees an orthopedic doctor, we will be able to identify exactly what the problem is, following some tests and X-ray and all that. So that should be sorted. So she should take mama to an orthopedic expert. Then the other woman talked about erectile dysfunction. That's what we call it, when the man cannot initiate or sustain erection for a reasonable amount of time. She said 20 seconds, could be more, it could be less. There are many reasons. If there's a popular demand, we'll talk about it another time, but because it's a whole topic of
There's a popular demand, I beg, come back.
Okay.
Which day you go come back to talk about this one? Because many homes don't scatter because of this, you know.
Okay, so I will inform you, Your Excellency.
Okay, sir.
The thing is, even psychologically alone, it can be a reason for that.
House rent,
so
fees.
there are many, and we'll talk about the causes and some ways in which and the reason why we should talk about it too is because there are many solutions that are not solution. And it's all over the internet, and it's causing people more harm. I talked to BBC once.
This one, Mr.
Yes, so it's good to throw some light on that. Then that is related to the young man I don't know if he's young, the man that said his private part is getting smaller. Well, that might just be related to psychology too, or maybe the temperature, or so it's
infection.
Yes. Well, infection will hardly cause it. Yes. It's the state of the mind. Yes. Then he also talk about the fact that he passes gas whenever he wants to wee or poo. The thing is, whatever you put into your mouth would ultimately come out through the anus. So if you are
solid,
or
liquid, semi-liquid, or air.
Yes. So if you are swallowing a lot of air, maybe in the process of eating and talking, or in the process of sleeping, some people, different habits that makes you swallow air. Ultimately, the air will come out from the bottom side. So, but it's not necessarily a problem if that has been the habit. But there are some diseases.
Early morning piece they carry escort, and that escort na mess.
Exactly. So, but there are some diseases that comes with gas, excessive gas, because there are some gas-forming organisms, infection in the intestine, that causes one to produce plenty of gas. For that one, it can be treated. But for the general one, it's just either a change of habit or you just leave it the way it is. Thank you very much.
Yes,
These are
sir.
all the questions.